Hi, I'm Dr. Obermeyer, and the purpose of this video is to review anterior cruciate ligament, or ACL tears. The anterior cruciate ligament forms a critical stabilizing function deep inside the knee joint, where it sits perpendicular to its neighbor, the posterior cruciate ligament, or PCL, and the two tissues form an X. The function of the anterior cruciate ligament, or the ACL, is best understood in individuals that have an injured, absent, or previously torn anterior cruciate ligament, and we can study the effects of the function of the knee joint. Specifically, the abnormal motion between the femur and the tibia in translation or shifting of the bones between one another can cause problems with apprehension and giving way. More importantly, in rotation, where the bones twist in relation to one another, can cause problems with sporting activities, for example, when the foot is planted on a hard surface and the patient attempts to shift their posture or change in a different direction. Some of the other critical information that we know in individuals that have a deficient or absent ACL is what happens to their knee in long-term follow-up when the knee is shifting or giving out on a repetitive basis. We do know that there is compelling reason to believe that the knee joint in these cases can undergo degeneration or wear and tear, initially as a result of meniscal and other cartilage injuries, and later as a result of osteoarthritis. Anterior cruciate ligament tears are very common in the United States and are seen more frequently in certain high-risk activities. Specifically, things like football, volleyball, gymnastics, or soccer place the knee at risk, in large part because of the non-contact twisting or pivoting activities that are necessary to function at a high level in these athletic endeavors. Questioning an athlete that has a tear of the ACL will often elicit a history of a pop followed by a relatively rapid onset of swelling and pain in the knee joint and difficulty with weight or pressure on the leg. If you suspect you've had an injury to the ACL, it is important to seek evaluation, as there can be other injuries to other tissues in the knee joint, specifically the meniscus, which can impact treatment and sometimes necessitate an early evaluation with an MRI scan. The initial treatment for ACL tears is generally that of ice, compression, elevation, letting the swelling resolve while some of the muscles start to come back and the knee can start to move in a more normal fashion. The treatment for ACL tears depends in large part on the patient's age, functional expectations, desire to return to sports, as well as in some cases the severity of the injury or the structural nature of the tearing of the knee joint. In some cases, particularly those involving meniscus or cartilage injuries, early surgery is advocated, which permits full resolution of not only functional return, but also the limitation of progression of things like degeneration inside the knee joint. Some of the factors that advocate surgical restoration of the ACL include young patient age, desire to return to contact or cutting and pivoting sports, as well as a desire to return to some sporting activities that would place the knee at a risk of instability or apprehension and unease with attempts to resume sporting activities. Please visit our website for more information, and thank you for your interest in ACL tears.